Hey folks, Trent here from Anderson Training Systems, and here we're with Dr. Bobbie Bennett from Bodywise Chiropractic. And this is specifically for you runners out there. I know there's a lot of you that either don't stretch or hate stretching or all of the above. And she's going to share some tips and things with us in regards to why you should and what can happen if you don't and what kind of agony and pain it might cause. Now, Dr. Bobbie's a pretty accomplished runner herself. Ragnar races, marathons, the whole deal. Pretty fast too, if I'm not mistaken. So thanks for stepping in with us.
Sure.
And so let's talk about it. A lot of people, from my experience of talking with people that are kind of serious recreational runners, don't stretch. Maybe you aren't doing the type of stretching that they should. What are some things that they can look forward to that they might not like if they don't do this kind of stuff and spend some diligent time, especially the more miles they get on them probably?
Sure. So over time, if you do any kind of repetitive activity, running being one of them, the muscle tissue tends to shorten up. Muscle fibers aren't as long as they used to be. So you go and do these activities that you're normally able to do without pain, and now suddenly you get this tension. Maybe you're starting to get some cramping in the muscles because you don't have the circulation that you need in order to get all the blood to the tissue. Maybe you're getting waste buildup, that lactic acid after some of your workouts, and you end up with a lot of soreness after the fact. So stretching is not only good in lengthening out the muscle tissue, but it's also going to help to keep that circulation and lymphatic system moving properly.
And it can be a little uncomfortable, especially if you got a lot of miles on you, correct?
Absolutely, yeah.
And what are some maybe tactics that some people might want to use if it's a little uncomfortable? It should never be painful, obviously, but uncomfortable to maybe help the stretch benefit them as opposed to just saying this is uncomfortable and bailing out of it.
Right, so one thing you can do is you can do some of the stretching, or you can do some self-myofascial release in combination with ice. Ice is a great pain reliever. You can utilize it, like let's say you are working on the bottom of the foot, you've got some tension in the plantar fascia. You can use a water bottle, fill it 3/4 full, freeze it, and use that as your tool to do your self-myofascial release. So now you're not only releasing the tissue, helping to lengthen it out, but you're also icing it at the same time.
Awesome.
Yeah.
So you're going to take a look at some of your special tactics that for somebody who's got a few miles on their legs, also in a different aspect, and it's a little uncomfortable. It's highly valuable. It's kind of a stripping type of activity from the gastrocsoleus down into the plantar muscle, right?
Right. So you've got a fascial line. It's on the posterior part of your body, on the back here. And the fascial line, it obviously goes all the way up your back, the back of your leg, into the hamstring as well. But we're going to focus on the knee down. So you've got your gastrocnemius, which is the part of the calf muscle that you actually see, the two heads. Deep to that, you've got your soleus muscle. So the two of them together make up your calf. Now they come together and they actually form your Achilles right down here in the back of the heel. And you've got a material, it's called fascia, and it surrounds the entire area, and it's also between the two muscles. And that fascia is what allows muscles to glide over one another when you do your activities. That fascia then comes together, comes around the entire back part of the heel here, and now it becomes your plantar fascia on the bottom of the foot. And this is a term that a lot of people are familiar with. Plantar fasciitis is basically an inflammation of that fascia in the bottom of the foot. Now, if you get the pain in the bottom of the foot, which is very common in runners, many people just focus on working on the foot. But unfortunately, if you do that, you're only working on part of the problem. So what I do is I actually work on the entire area, the entire chain here, with a combination of fascial stretch therapy, which is a technique that I took some extra courses in, and work on opening up that entire fascial line. And then I also do some hands-on treatments. One of them is called gua sha. You use a fancy little tool like this. It's got a beveled edge on it. Sometimes you'll see massage therapy practitioners using a spoon, like a Chinese soup spoon, similar type of treatment. But what this does is it helps to break up any adhesions or scar tissue that might have built up in that fascia. You can sometimes get a little bit more aggressive with this versus just your hands. You see results a little bit faster that way. So I'll utilize this, and I'll also utilize this little mini drop right here. Do some mobilization of the joints as well, because you've got to work on not only the soft tissue, but then you've got to mobilize the joints to get the entire system functioning properly. So first thing I start with is I look and see what kind of mobility we actually have in the ankle. We want to look and see, okay, where's our plantar flexion? Where's our dorsiflexion? A lot of people get caught up right here in the front part of the foot, get really jammed up in here. Maybe it's because your shoes don't have, you know, the right support. Maybe you've got weakness in the bottom of the foot, the way that you're landing as you're running. But this is an area a lot of times we need to open up. And many times it's because the calves are so tight, and they're actually causing everything to shift forward. So in order to get this to push back and stay back, we've got to open up this entire area here. So what I'm going to show you is first some of the fascial stretch therapy that I do. So to stretch this out, we use a little bit of what we call a PNF type of stretching. So I'm going to have Troy actually inhale and press his leg into me here with about 20% of his strength. Exhale, relax. And I'm going to repeat that 3 times. So press here and relax it. Now this one here is for the gastrocnemius because his knee is straight, right? So now, next one we're going to do is actually bend his knee up. Now we're going to get that soleus. And when you do these stretches on your own, you've got to change that knee position. So again, press into me here, like you're stepping on the gas, and relax. And again, relax. And one more time, and relax it. Good. Last thing we do on the stretching is actually traction out that front part, and this is also good if you have some chronic shin splint problems. This is going to stretch the front of the leg as well. So go ahead and press those toes up towards the sky, and then relax. And again, relax it, and one more time, and relax.
Yeah, because the locking up of the ankle is something I notice a lot in people, and the conversation we had in regards to talking about how the Achilles runs down, and when we get to the Gaucher stuff, it'll be really interesting to that posterior part of the foot, the back by your heel, and how that can really get tender and locked up.
Yeah, absolutely. So this is definitely the most sensitive part of the treatment. Most people squirm around the table quite a bit. It's quick though, so if you just breathe through it, you actually can get through it pretty good. So what I do is I use my knuckles, and this is a treatment I actually don't do any kind of lotion or anything with. I'll just spray it actually with a little bit of water, or I'll just get my water. Let's see, I've got a water bottle here. I should have grabbed it. Alright, got a little bit of water here, and I'm just going to do just a little spray. That provides just a little bit of a medium. Now I don't want this to be slippery with lotion, because what I'm trying to do is actually open up the area between the skin and the tissue just below it. So I'm not stripping the muscle here, I'm actually trying to open up this area in between the skin. This is going to help release the calf area, and it's also going to help release the plantar area. So all I'm going to do is just do a couple of really quick strokes all along the side here. And like I said, this is a pretty intense treatment. Most people aren't quite as calm as Troy is when I'm doing it. But you go along the heel here. You can also go up the sides of the heel. So this is just getting that fascia moving at that connection between the plantar fascia and the calves. Now, if I want to go a little bit deeper with that, that's when I can go in with the gua sha treatment. And I'm going to use just a little bit of lotion for this, but what I do, and this is really great if I find a specific adhesion, maybe that you've had a previous ankle sprain or an injury that's caused a little bit of scar tissue to build up, that's going to cause dysfunction in the ability for you to stretch that area. So go in and actually just do some scraping on that and break that tissue up. A lot of times you'll see a little bruising come from this just because the capillaries just below the surface will break up just a little bit, but as you go through, and you can do this here, you can go down, if we've got some plantar fasciitis issues, do some scraping, and you can do this same technique to the calves, but I'm shortening the tissue, and then I'm lengthening the tissue. So I'm really just trying to open up the length of all that tissue, because over time things just tend to get tight. And a really common reason for me to see this in the bottom of the feet is someone who maybe wears a shoe with too much support all the time.
Okay.
You actually want to try to be barefoot sometimes, build up the strength in the bottoms of your feet, and build up the strength of your arches. You don't want to go right into doing that. Something like a 5-finger shoe, you know, after you've been, you know, wearing an orthotic is going to be too much of a change. But slowly trying to build up strength in the bottom of your foot is going to help you prevent problems in the future.
Cool.
Yeah, and then basic mobility, you know, we can do just some traction. And then, like I said, this area here, a lot of times I want to get that to go down. I can
now, what's the name? Is that the talus joint or bone?
This is where your tibia and your talus come together.
Talus,
yep.
okay.
It's a dome-like
very common
joint.
area for there to be some structural dysfunction.
Right. It'll get a little bit caught up in there because this is just like a little dome. So what you want to see is a nice rocking motion in through here, and that's why you should be able to completely dorsiflex your foot. But when people get caught up and they say, it feels really tight in here, usually you're not getting that rocking motion. So it's a real easy area. If you scoot back just a little bit, Troy, I can show you. Just using this little drop here, I can actually go on and using a little bit of an impact here, just drop that right back into place. Now, if I've already worked on the soft tissue before I do this,
should move.
Now it's going to move and it's also going to stay. If you don't work on the soft tissue and I adjust that, it's probably going to be pulled back out of alignment.
Awesome. Great tips, Dr. Bennett. For those of you that have been ignoring, maybe you should take some of those tips and apply them. Some of you that have maybe doing but not getting as much as you can out of your stretching, or just feel like it's not working, you're just going through unneeded discomfort, those are some tips for you to help get better running. Just as a point of reference, what's a normal run time for you, Dr. Bennett? Let's give me a half marathon time.
A half marathon?
Best time. PR. Give us a PR.
I run a 146.
Okay, very impressive.
Yes. I'd like to drop below the 145 time. So.
There you go. Everybody's got a personal record that they're shooting to get down. So appreciate it. Check it out. We'll get some more good video out for you guys. And make sure that you're warming up that body before you hit the streets.
All right. Thanks, Troy.
Goodbye.